Okay. Hi, everyone. This is Desiree, Program Coordinator. Nice to meet everyone.
I am Cynthia Jackson, Programs Person with NMS.
And I'm Ellie Ogai, Programs Associate.
And we'll be working with you guys as we go through this
Thank you for joining us. So, congratulations to everyone for being awarded the 2015 Dr. David Monash John Caldwell Scott Medical Student Scholarship Program. You may not know this, but our tagline is changing the face of medicine. So here are some pictures of some of our scholars from the past. A little bit about NMF. Our mission is to provide scholarships for underrepresented minorities in medicine and the health profession. So we provide scholarships to minority medical students across the U.S. We also have a number of programs that are open to physician assistants as well as graduate level nurses. And so we were founded in, actually I'm going to mute everyone right now because I'm getting some feedback, sorry. We were founded in 1946, so we are actually celebrating our 69th year, rolling into our 70th year in Chicago. So that is our home. We were founded on the campus of the University of Chicago, and at the time it was to assist African American medical students in finding residency placements. And over the years we have grown to include other minority groups, so we also include Hispanic Latinos, Asian American, Vietnamese, Cambodian specifically, Native American, Pacific Islander. And then we also, with some of our programs, allow for first-generation students who are not within those minority groups as well. So our primary goals are to achieve equity of opportunity in medicine and have access to quality health care for all, and to increase the number of minority physicians and change the face of medicine to better reflect and serve our diverse population. So this particular program that you guys are a part of is a partnership between National Medical Fellowships. I did mention that we are now headquartered in New York, so all of us that are speaking here today are in our New York office, but we also do have an office in Chicago on the campus of Northwestern Medical School. So this is a partnership between NMF and the Chicago Community Trust, and it was launched in 2012 in response to the health report for the GO-TO 2040 regional planning campaign in Chicago. And basically, that report projects that Chicago will become increasingly diverse and lack an adequate workforce to satisfy their healthcare needs. So this program was founded to address that. Since you guys are all in medical school and you will become doctors, we want to ensure that you guys are committed to the healthcare needs of Chicago, and the idea is that getting you involved in the community early in your career will allow you to continue to do that as you progress throughout your career. So, sorry. Here's a listing of our 2015 service scholars. There are 6 students who have been awarded, and I'd like for each of you to introduce yourself. So, Michael, can you tell us a little bit about your background and about what your project is?
Yeah, so I, as you can see, I'm a student at UIC. I'm a 3rd year now. My project is actually to, I guess, create an online component to a pipeline program that already exists at the university. And so ultimately we want college students who are leaving the Chicagoland area to stay involved and to really understand what it takes to be a good medical school applicant so that they can come back to Chicago for medical school or residency or practice and give back to the communities they came from.
Thank you. Marissa, can you tell us a little bit about your background? Marissa, are you there? Marissa, does your microphone work? I'm going to leave you unmuted, so if you can give your introduction, you can do that a little bit later. Letty Esther Martinez, did I say that right?
Hi, yes, can you hear me?
Yes.
Hi, everyone. My name is Lydia Esther, and I also attend UIC College of Medicine. And I'm also piggyback on another project that was completed actually through another alumni of the MonashScott program. And basically, the project entails medical students going into hair salons and educating hairstylists about domestic violence and how they could catch signs in their customers. And what we basically want to do is follow up on the project that was done in past years and see if it had an effect on the knowledge that the hairstylists have, and if there's anything else we could do with them to better assist them in their current needs, and pairing them up with another organization called Mujeres Latinas en Acción, who would be the people that the customers would follow up with if they do have issues going on at home. And we just want to see how well that project has been working. If there's anything we could do to promote it and make it continue to be self-sustaining, so other students in that follow on years after could also follow through with it.
Nice. Who was the MonashScott scholar that worked on it previously?
Excuse me?
You said that you're piggybacking off of a project that another scholar had worked on before. Who was that scholar?
Yuri Torres.
Yuri. All right. Thank you.
Mm-hmm.
Rachel?
Yes. Hi. Can you hear me?
Yes.
Okay, good. So hi, everyone. My name is Rachel. I'm a student at the University of Chicago. I just finished my second year, and for my project, I'm going to be working with the University of Chicago Charter School System, which has 4 different campuses, and I think it's pre-K through 12th, and I'm going to help develop a health infrastructure. So there's already been a group working on this, like with people from the school and from the university, and they've developed a health policy. So I'm going to help implement some of that health policy and do needs assessment with the teachers, parents, and students, and help write some curriculum. I was formerly a middle and high school teacher before I started med school, so I'm going to help with their health policy and health curriculum.
Thank you. And here are our 4 residency scholars. So this component of the scholarship, these students are not in the field because they're starting their residencies. These are all students who attended medical school in Chicago and matched Chicago, so are committed to working with Chicago to better their healthcare. And just talk a little bit about where you went to school, where you matched, and some of the things that you've done with the city of Chicago. Nikita?
Hello, my name is Nikita. I graduated from Loyola School of Medicine. I'm currently a PGY1 at Rush University Medical Center in the Department of Obstetrics and Gynecology. Most of my involvement in medical schools kind of doing outreach community projects. And so I was very involved in our SNMA chapter at Loyola, in which we work with the Maywood Youth Foundation, and so we'll offer tutoring service as well as mentoring service with the students at the library, as well as was involved with the organization called the Butterfly Girls. And so this was just an opportunity to kind of empower the young girls and give them another source of activity. My thing was I did belly dancing in college, so I show how you can be empowered by your body through dance, and so that was one component that I did, but also with the other, with our president, who is also on here, Jace Richard, we also did a lot of health education, and so just teaching them about health and different type of pressures that they get, and about food deserts and things like that. I also was involved in this organization called CHAMPS, that is pretty much an organization that supports students who have an interest in health-related fields from high school all the way up until residency. So I taught a MCAT course on physics and chemistry because that tends to be the subject people are scared of, and that tends to be my strong point. So I worked with them most recently with their MCAT curriculum.
Nice. Thank you. And also, do you want to talk about your previous NMF awards?
Yeah, so I had 2 opportunities to participate in the Global Health Initiative with GE as well as NMF. Most recently, I had an opportunity to go to Kenya, in which one of the projects that we worked on as a group was to better understand this free maternity service that they're implementing in Kenya to help address the high mortality rate in the country. And then previously, last year, I had the opportunity to go to Ghana, in which at that location, we also worked on maternity health, and then my particular project deal with hypertensive crisis in pregnancy, because during my observation I was there, it was just one of the things that I noticed that tends to come up a lot, and that the protocols were, even though they had protocols, a lot of people didn't practice the protocol to the T. So my goal was to kind of see what were the protocols, and then implement the knowledge of the protocols, and then give them the information to take care of those, to manage those cases appropriately.
Thank you. And last but not least, we have, I want to say, Jace Richards. Is that right?
That is correct. Hello, everyone. My name is Jace Richards. As you know, I went to Loyola Stritch School of Medicine with Nikita, and have lived very similar lives in terms of what we did while we were at Stritch. I was very active in the SNMA, the Loyola chapter, both my first and second year. Most of that was through mentoring, both the drop-in program and Butterfly Girls. We would focus mostly on trying to encourage women between the ages of 6 to about 17, I believe, with positive body image, teaching, and kind of mostly teaching them the important aspect of health and how it relates to their image, their positive images to come. Additionally, I taught an MCAT class while I had some free time. I did biology because that was my strong point, and tried to encourage people. It was through exam crackers, but I did have a few Black and Latino students that kind of got a little extra attention because they requested it, to help support them in that role to transition into medical school. I also was able to participate in SNMA on a national and regional level, serving as the regional director for SNMA for 2 years. So kind of just always bringing it back to Chicago, the issue of gun violence, seeing what we could do on a national level to bring those issues to light, and participated my 4th year, I believe, in the Harvard Visiting Clerkship Program, which encouraged minority medical students to go and do 4th year clerkship electives and sub-Is at very competitive programs. So I'm currently working with my program director. I matched at Loyola. I'm in PEDS, and we're trying to start a similar program at Loyola currently.
Nice, thank you. And I believe we have Marissa was able to join us. So, Marissa, are you there?
Yes, can you hear me?
Yes.
Okay, great. Sorry about that. I'm also a rising M2 at UIC, and my program is stemming from something that also already exists, the Young Doctors Program, which involves elementary to high school kids who are interested in some kind of healthcare professional, whether that be medicine or dentistry or even veterinary medicine. And we basically teach them lectures every Friday evening for about 2 hours, centered around a certain theme that they're interested in. So, for example, this year it will be infectious diseases. And what I hope to do is implement something called mentoring families. And this would basically put the students into groups, ideally pairing a younger student with a high school student, but also with people on different paths along their journey. So if there's a student who's interested in medicine, for example, we'd have a couple of those students with a medical student, but also a resident, and hopefully an attending. And within those families, they'd be able to meet, to go over about what they're interested in, but also hopefully, especially with the high school students, we'd eventually like them to get shadowing and internship opportunities with their attending mentor.
Great, thank you so much. Okay, so here's a rundown of what we'll be talking about today, the program requirements. We'll go a little more detail about some of the written documents that you're required to submit, the end of the program event, as well as promotion of the program while you're in it. So all of these, most of you have submitted all of these required forms, and these are all required in order for you to receive your first disbursement. Letter of agreement, letter of appreciation will actually come at the end of the program after you've completed the program. Electronic submission of your headshot. If you have not submitted it yet, please do. It needs to be high quality, and just so you know, we do actually use these photos to print in our program journal for the gala that's going to be in December. So we actually do print the photos that you guys send and use them for promotion. So if you don't like the photo that you submitted or it's low quality, you can feel free to submit a new one and we'll use the new one. Verification of medical school enrollment. For service students, we need a budget detailing your expenses during your time in the program. And it's not that we expect you to use your scholarship to pay for your project, but we do want to know how you plan to implement, and this helps give us an idea of how you plan to get certain resources for your thought process. And also, if we're able to, then we will try to provide you with some resources to get in-kind donations, or maybe we have some of these things available for you. So that's the reason why we asked for the budget. And then we actually no longer do the community health proposal form. That will be the pre-program survey that your site mentor will complete describing your project to ensure that you have someone who's working with you. So here are some of the deliverables, the requirements. Everyone's required to do a written report, 5 to 10 pages, so it's a short report, as well as an oral presentation. It's about 6 to 10 PowerPoint slides, and you'll have about 5 minutes to actually talk about those slides. And you'll present your PowerPoint presentation at our colloquium. And it will be a kind of a roundtable discussion where everyone is expected to be involved. So not only are you presenting, but you're listening to your colleagues as well, providing feedback. Attendance to the colloquium is mandatory. We have not determined the exact date for that yet, but it will be in November. And then in December, we'll be having our Champions of Health Awards, our Chicago Gala on December 8th, and you guys are all invited to attend that as well. It's a great networking opportunity. We usually invite students from all of the schools in Chicago, minority students as well as the diversity deans, healthcare leaders. It's a great opportunity to meet some NMF alumni who are in the area, who are residents or already in practice. For an oral presentation. You're also required to attend the colloquium, which is mandatory, and you're invited to attend the Champions of Health Awards. We expect that it'd be difficult for you guys to attend both events, so we really need you to attend the colloquium, but the Champions of Health Awards. It's a great opportunity, but we understand that with your scheduling that you don't have much time. So. Monthly updates. So on the first of every month, you're required to provide an update to us about your previous month's experiences. So for service scholars, we expect you to provide program activities, how many times you met with your mentor. We actually do need the number of hours you've completed, since there is an hour requirement per month, just so we can keep track to make sure that you're on track to complete this in time, as well as any personal reflections. If something happened during your project that you kind of received an epiphany on, we'd love to hear about it. And then for residency scholars as well, we ask for monthly updates. And since you aren't working on a project, this is more of a reflection of what you're experiencing. So how has your transition into the workforce been? Any issues or things that you think that other future residents should be aware of. And then we know that your time is limited, but if you do have the opportunity to work on community service activities or anything outside of the hospital, or if you receive some interesting cases, then we do want to hear about your commitment to healthcare issues in Chicago as well. So even though you aren't actively doing a service project with us for the scholarship, you still do need to submit these monthly updates to us. So we ask that you complete the bulk of your hours, if not all of them, by October 1st for the service scholars, so that you can submit your first draft. We do review your papers and provide you with feedback, and then also during the month of October, you work with one of our consultants with public speaking training, so that you can be prepared to present your project in November. And so we do need to have a good idea of where you are with your project, and the bulk of that needs to be done by October 1st. The final will be due on October 30th. We ask that you have a well-organized paper utilizing headings and subheadings. It should not exceed 10 pages. That includes the appendix, so it's a pretty concise paper. We ask that you cite all of your references. If you have direct quotes from participants, we love seeing those. And we organize it basically into these 5 points: introduction, methodology, findings, conclusion, and then discussions, recommendations, and steps. So here's a little more description of what we expect to see within each of those sections. A description of the problem or the issue, the importance and magnitude of the problem in terms of the city of Chicago, specifically what population you're targeting. You're working with just students, you're working with just like homeless women. We want to know what population you've chosen and what your intervention actually is. And then the findings would be like the raw data, the outcomes of your intervention. Conclusion is the summary of what that actually means in the larger scope. Your impressions of the experience, how what happened compares to what you expected to happen, and then your sustainability. What are the next steps? Are you going to be involved in those, or someone else that's going to take over? And then your final recommendations for the project. So here are some tips from previous scholars. One is to start early. I know that we're getting a little bit of a late start because we're in July, but start early, because as the year progresses, especially for the service scholars, the school rolls back around, your time is going to be limited. So start early, get as many hours in the beginning as you can. Ask questions if you aren't sure about something that's happening at your site. Make sure that you're working with your mentor to get those questions answered. If you have questions about what's required of you from us, don't be afraid to ask, and don't wait till the last minute. It's much easier for us to help you if you ask about these things in advance. Maintain communication with your site. Some of you may not be working actually at a site, but maybe working remotely. It's important to maintain that communication with your site mentor. And set realistic goals. If, as you start your project, you realize that it's not turning out the way that you thought it would, it's okay to revise your project to make it something that's realistic. So it's okay to keep looking at it and revising it as you go along. Just let us know in your updates that you're planning to do that. And so here's a quote from one of our scholars early on in the project, in our programming. The project is not about your own objective, but identifying a problem in the community and working towards a solution. So something to think about as you're moving forward with your project is that it's not just about what you're doing singularly. You want to make sure that it fits into something bigger, so that it does relate to not just like these 10 or 20 students that you're working with or participants in your project, but to the larger community. So during your oral presentation, something to think about is you want to make sure that what you're presenting, it may not be exactly what is in your paper, but it's something that's engaging. You want to make sure that it's presented in a way that everyone who attends can understand. So it'll be your colleagues here on the call in the program, NMF people. There will be NMF alumni that are there, and we also invite all of the community advisors, everyone that you're working with at your community sites. So just remember that as you heard, your projects are really different. So you want to make sure that you're presenting it in a way that someone who isn't necessarily focusing on what you're focusing on will understand what you did and the importance of it. Continue to use the bullets to help keep it organized, and allow for some time for questions and answers. So you'll have 5 minutes to present, and then at the end, after everyone presents, we'll be able to have some question and answer. And use visuals. We love pictures. I know some of you guys are working with children, so you may not be able to take pictures all the time, but if you're working on a project where you're able to take pictures, we love seeing those. So here's an example of one of the Service Scholars projects from a couple of years ago. He did an independent project on mental health in like the homeless community. So here is his introduction, the sites that he worked with, methodology, his findings, his conclusions and recommendations, and then his acknowledgments. So we will be putting an orientation packet on Canvas, and you'll have access to a number of sample projects as well on Canvas, as well as this PowerPoint that I'm presenting. And then for the service students, here's an example of a service, of a residency presentation. Since I know sometimes you guys aren't really sure what to present, here's an example, and we have some more on the orientation packet. The introduction of who she is, where she went to school, her background, the impact of the scholarship on her personally, how her career will address physician shortages in Chicago, some of the work that she's done in the community, and then some of the people who have worked with her. So during the colloquium, as we mentioned, it's an opportunity to have a kitchen table conversation. So we ask that your information be concise, as well as you guys it's interactive, so that you're listening to each other and asking questions. And just remember that it's okay to disagree if you have questions about someone's methodology, about their project. It's okay for you guys not to agree all the time. But maintaining openness and interest and respect throughout the event. So here are some pictures of our scholars from the beginning of the program. The first program was in 2010, 2011, 12, 2013, 2014. So social media, we are on social media. We're at NMF Online, and we ask that you guys connect with us. If you're tweeting about your project, we ask that you tag us in it. Also, our sponsor, the funder of this project, the Chicago Community Trust, is also online. They're at Shy Trust. We also ask that you hashtag your pictures that are related to your project with NMF Scholar, just so we'll be able to track you. We won't follow you, but we do want to see what you guys are doing, and we'd love to help you promote your project as you go along. The program evaluation. On Canvas, you'll see links to our pre- and our post-program surveys. So residency scholars are only required to do the post-program survey for scholars. But for service scholars, you're required to do the pre- and post-program, and you have to get your site mentor to do the pre- and post as well. And your responsibility to ensure that that is completed. And these are required just so that we have an idea of your expectations at the beginning, how that worked out for you at the end. It also confirms that you've completed all of your required hours, and allows us to get feedback from you in ways that we can change the program for the future. So I wanted to thank you and welcome your participation to the 2015 group. At the end, during the colloquium, you'll be invited into our alumni network. And so it's really important that you're there. And we just wanted to thank you for being here and wish you luck on your projects in your future. If you guys have any questions, the team is always available at scholarships@nmfonline.org, or you can reach us by phone. And actually, sadly, today is my last day of NMF, but Desiree and the rest of the team, they are on board and they are able to answer any questions that you guys may have. So I'm going to unmute you guys and let us know if you guys had any questions. Okay, so you guys are all unmuted. Do you guys have any questions for me about any of the requirements or the program?
Hi, I'm Lydia Esther. I just wanted to triple check. There were 2 bullet points for I wasn't sure if those were 2 separate colloquiums or is it just one?
It's one colloquium for all the students, so both the residency and the scholars will be together.
Okay, perfect. Thank you.
Mm-hmm. Anyone else? No questions? Okay. Well, as I mentioned, we're available by phone or on email. So if you have any questions later on, feel free to contact us and we'll be able to answer them. Thank you.
Thank you.
Thank you.
Thank you.
Thank you.